Good evening, esteemed viewers. I am Simran Kaur, and it is with great pleasure that I welcome you to the premiere of our virtual series Diabetes Dialogues. In this formal virtual setting, we have the honor of sitting down with Dr. Balaji Jaganmohan, a distinguished consultant, physician, and diabetologist at Apollo Clinic in Bangalore. Let's initiate episode 1 with an insightful dialogue, and I welcome you, Doctor.
Thank you so much. It's a pleasure to be here.
It's an honor to have you. So, starting with the first question, Dr. Balaji, I would want to understand that managing blood sugar levels is a daily challenge when it comes to people with diabetes. So, how do lifestyle factors contribute, and what guidance would you like to give to such people who are managing this on a day-to-day basis?
Yeah, so what we understand is that diabetes is a chronic, lifelong disease. So people who are living with diabetes, whether it is type 1 or type 2, they have to be adherent to a good lifestyle, which means that they have to follow a good diet, they have to exercise regularly, and they have to be taking their medications regularly. Apart from that, they have to also self-monitor the blood sugar. So most of the diabetic patients, if they have a glucometer at home, then they can record their blood sugars at periodic intervals, and they also have to follow up with their treating physician. So one of the challenges in India and across the world is that follow-ups are very poor with the treating physician. So that is one of the reasons why only 30% of patients across the world are having good blood sugar control. So when we talk about sugar control, we measure this variable called HbA1c, this test. And only 30% in the world are having their HbA1c that is less than 7, which is good control. So if they have to manage their blood sugars in an optimal way, they have to follow a good diet, they have to exercise regularly, they have to take their medications regularly, self monitor the blood sugars, and follow up periodically with their treating physicians, get all the blood tests that have been advised by their treating physician, and also screen for complications. So there are some complications related to the heart, the kidney, and the eyes that have to be checked regularly.
Right, doctor. So, doctor, one follow-up question: how often should a person be following up with their doctors when it comes to diabetes?
So ideally, every diabetic patient should visit their treating physician once in 3 months. But suppose if you have individuals who have good sugar control, they do not have other comorbid conditions like hypertension, high cholesterol levels, or they do not have any established complications that have affected their heart or kidney or any other organ, then they can even follow up at an interval of around 6 months to 1 year. But ideal, uh, the recommendation as per the most of the guidelines, whether national or international, is once in 3 months.
Okay, once in 3 months. So, doctor, if we speak of the digital age, the impact of technology is undeniable. So, maybe you could just elaborate on the importance of continuous glucose monitoring and the benefits that can be witnessed by the patients.
Yeah, so now if you see off late, there have been a lot of technological advances in the management of diabetes and also in the monitoring of diabetes. Now, when you mention about CGMs, the continuous glucose monitoring, so there are a couple of providers or companies that manufacture these monitoring devices. So you have Freestyle Libre from Abbott and you have Guardian Connect from Medtronic. So these are the two continuous glucose monitoring or flash glucose monitoring systems, if I may say, that are currently available in India. So CGMS is something that can be done in a certain subset of patients. It's not something that is indicated for all diabetics. Generally, we use it in people who have a lot of fluctuations in their blood sugars, what we call glycemic variability, or we even use it in people who cannot use a glucometer to monitor the blood sugars regularly at home. Or there are other indications which require more close monitoring because CGMS will help us to understand a lot of things. So we can understand how the consumption of food would influence their blood sugars, how a particular exercise can affect the blood sugars, or even the medications. For example, if they're taking insulin, or if they're already on an insulin pump, or whatever oral medications, tablets that they've been consuming, what effect do those medications and insulin have on the blood sugar, all that can be captured on the CGMS, plus other things that is part of a routine lifestyle. The sleep patterns, how does it affect stress levels? How is it going to affect the blood sugar? So a lot of daily lifestyle activities can help in trying to monitor the blood sugars through the CGMs.
Right, doctor. So, diabetes can, like you mentioned, can influence the daily activities as well. So, what adjustments can the individuals make to lead to a healthy lifestyle? Like you
So, like I
mentioned
already
about
said,
sleep.
they have.
Yes, yes. Please go ahead, doctor.
So, following a good lifestyle, having the diet that is being prescribed by a registered medical nutritionist, which is low in glycemic index, low in calories, carbohydrates. So, the meal plan that is being prescribed to them by a registered dietitian. Apart from that, regular exercise for at least 30 to 45 minutes a day. Ideally, exercises should comprise of aerobic exercises, resistance training, and relaxation techniques. So proper diet and exercise along with the medications and sleep. Now, sleep is something that can affect the blood sugars. It can also lead to an elevation in the blood pressure. Cholesterols can go haywire. So sleep for at least 6 to 8 hours is important if you want to manage your blood sugars adequately. And stress management. So I said relaxation like yoga, any deep breathing relaxation exercises. Because nowadays in this age and era, people are pressed for time, and stress is something that is a common influencing factor for most people who have diabetes or they develop diabetes due to a stressful lifestyle. So stress management is again very important for a diabetic patient.
Thank you, doctor. So now, turning to media, if we talk about media, how do you perceive media's role in raising awareness about diabetes, maybe busting the myths that are there, and disseminating accurate information when it comes to diabetes?
Yeah, so I think that media they play a very important and a very responsible role. So in this age and era, if you see, there are a lot of junk foods that are available and easy access to that. A lot of food ordering apps which allow you access to high calorie food, foods that can immediately raise your blood sugars and increase the risk of developing lifestyle diseases like diabetes, hypertension, and obesity. So media, I think, if they can kind of create awareness in a more responsible fashion, and they can access a wide age group of people, right from the young, the school-going children up to the elderly. Because if you see currently, it's the younger population, at least in India, who are developing diabetes, and it's purely due to lifestyle, the diet and exercise patterns. So I think a lot of awareness, a lot of education that can come through media platforms, whether it is social media or the conventional, the mainstream media, would definitely help in creating awareness right at a young age. It's the school going children, if at that age we can try to influence their lifestyle habits, then we can try and prevent or reduce the burden of lifestyle diseases like diabetes.
So, doctor, we would want to discuss about some of the breakthroughs that maybe you could highlight when it comes to the developments in diabetes management. How has the landscape evolved, and what are the changes that we've witnessed in the recent years?
So there has been, definitely a paradigm shift as far as diabetes management is concerned. Uh, if you see in the 20th century, so in the late 90s, there were only few medications that were available for diabetes management. But after 2006, there have been few new classes of drugs that have come into the market. We call them DPP4 inhibitors, GLP1 analogs, and SGLT2 inhibitors. So they have actually revolutionized the way that we manage diabetes. So it's become much easier for us because many of these drugs they have benefits that are beyond blood sugar control. So they also help in blood pressure control. They help in weight loss. Some of them are protective for the heart as well as the kidney. So there are multiple pleiotropic effects that we have witnessed with the newer medication. So this entire 21st century, uh, after the mid of the first decade and now into the second decade has been very colorful. And now I think, as far as the treating physicians are concerned, we have a rich armamentarium in terms of the drugs that are available, even for insulin. If you see, there are a lot of modern insulins, what we call second generation insulins, which have hit the market, in this second decade of the 21st century, and also insulin pumps. There have been advancements in insulin pumps. In fact, we have something called the artificial pancreas like insulin pump, which is a closed loop pump which will behave just like the pancreas of a non diabetic individual. So, a lot of advances have happened in this 21st century, and I think that patients now have a lot of options as far as management is concerned.
Yes, doctor. So, I would want to understand, considering the evolving healthcare landscape, one of the burning topics is telemedicine and virtual health platforms that have, gained a lot of prominence. So, have these digital tools impacted diabetes care as well? And if you would want to talk about some of the benefits that they can offer.
Yeah, definitely. I think telemedicine is something that is still ongoing. In fact, it was legalized and accepted by the National Medical Council (NMC) in April 2020. So when we had the COVID pandemic in March, immediately after that, the next month itself, they had legalized that all treating physicians can use telemedicine as a tool for diagnosing and treating patients, and that included patients who have lifestyle diseases like diabetes, hypertension, cholesterol, etc. But of course, there are certain rules that have to be followed in terms of what investigations and medications that can be prescribed for new patients vis-a-vis a patient who's a follow-up patient, otherwise who has seen us physically and wants to have a telemedicine consult now through a digital platform. I have used telemedicine very effectively. In fact, it's been one of the main, you know, mediums or platforms through which I have been consulting patients during the COVID period, where I have seen patients across the length and the breadth of the country. And fortunately, working in Apollo, it is much easier because the other services that we have in Apollo, like Apollo Diagnostics, they are in Apollo Pharmacy. So if I have to consult someone, let's say in Bihar or any other place, then automatically I can get the blood test done through Apollo, even the medication from Apollo Pharmacy being delivered there. So this is my experience that I've had during the COVID pandemic period. But telemedicine definitely has picked up, and there are several platforms available. We can have video consultations, we can have audio consultations. There are chat mediums that we can engage with the patient. So telemedicine definitely, even patients in rural areas, other tier three, tier four towns that want access to doctors in urban cities. Now this is something that's become very easy for the patients as well as for the doctors.
So, you spoke of the tier three, tier four cities. I would want to understand that uh, how familiar or how educated are people when it comes to tier three, tier four cities about diabetes management and diabetes care.
Yeah. So, unfortunately, the awareness on diabetes and the complications that occur as a consequence of diabetes, whether it is heart disease, kidney, diabetic foot ulcers, diabetic retinopathy, the awareness is very less. In urban areas itself, it is quite less. So, when we talk about tier three and four, I think this is where the mainstream media comes into play, where we need to educate and create awareness with these people that there are doctors in urban cities that can be consulted through telemedicine, and awareness has to be created regarding the complications that are revolving around diabetes, and diabetes being a silent disease. In fact, the most common cause of death in a diabetic is heart disease. Many of them are not aware, and many diabetics get a silent heart attack. Diabetes is the leading cause of kidney failure worldwide. Many people are not aware. So a lot of awareness has to be created, especially in tier 3 and tier 4 cities.
Yes, doctor. And before we conclude, I would want to know any key message that you would like to give to our audience, any myths that you would like to bust, and anything related to detection and proactive management of diabetes that you would want the viewers to take away from the session.
Okay, so my message to the viewers is that any individual who is above the age of 25, and if you have a family history of diabetes, if you have obesity or if you have abdominal obesity, and if you're leading a stressful lifestyle, you're following a faulty lifestyle, you're consuming junk food, there is lack of exercise, sedentary lifestyle, please get yourself screened for diabetes every year. Undergo a periodic checkup with HbA1c, the fasting PP, including the lipids. Check your blood pressure, because most of these lifestyle diseases are silent in nature. If you see the current trend in India, most of the people who are getting diabetes and other lifestyle diseases are very young, and they're not even aware. They're asymptomatic. They won't have any symptoms, and it is only through a routine screening, or by chance they went, to another specialist. They had fever or some infection, that they came to know that they have diabetes, which means that they've been living with the condition for quite some time. So anybody above the age 25 who have these factors have to periodically screen despite not having any symptoms. And diabetes is a deadly silent killer. If you don't have good sugar control early in the course of the disease, you will die of heart disease, die of kidney failure, dialysis. It can lead to amputations in the feet. So a lot of complications, and the cost that is involved in diabetes care and managing the complications is very high. So get yourself screened at an early age. If you have diabetes at an early age, you can even reverse or lead to a remission of diabetes if you pick up early. Follow a good lifestyle, exercise regularly, sleep well, manage stress, follow a good diet, and follow up with your treating physician on regular basis.
Right, doctor. So thank you, Dr. Balaji, for this for these invaluable insights in this inaugural episode of the Diabetes Dialogues. To our esteemed viewers, this is Simran Kaur from Voice of Healthcare signing off. Stay tuned for more enlightening conversations on diabetes, and may you stay informed and healthy. Thank you so much for joining us, doctor, and thank you for your time.
Thank you. Pleasure is mine.
Thank